wanted to give just a few quick examples to sort of set the stage here and give you an idea of what some major organizations that work internationally are focusing on. The United Nations Population Fund published a report called COVID-19 Global Response Plan, which outlined 3 strategic priorities: maintaining continuity of sexual and reproductive health services and interventions around the world, addressing gender-based violence issues, and ensuring the supply of modern contraceptives and other reproductive health commodities to populations around the globe. So those are some of the strategic areas that they normally work in, but are sort of redoubling their efforts under the sort of stresses of the pandemic. Many of you, particularly communication students and scholars, are probably familiar with Pew Research, which tends to focus more on domestic issues, but also does some international work from time to time. And they, not too long ago, released a report called National Responses to COVID-19 in 14 Advanced Economies. So these are the wealthier nations we're talking about here. And they actually surveyed 14,276 people. So that's a pretty solid end to draw from. And some of their conclusions, broad conclusions in this report: most people think their country has done well handling the pandemic response, with a couple of glaring exceptions: the United States and the UK. And if you follow sort of domestic politics in both of those societies, you probably have a good understanding of why. Women are more likely than men to say their lives have changed because of COVID-19. And I think if we understand basic gender roles across the globe, we understand also why that's a finding of this report. Publics generally agree that more international cooperation would have potentially reduced virus-related fatalities. So that gets right to why we are here, right? Communication and cooperation across international boundaries. And also, I think this is particularly important for our students. Younger people see more value in international cooperation to reduce the number of coronavirus cases. So if we haven't seen the level of international cooperation that we would have preferred, perhaps in the future we will, if hopefully it doesn't happen, but something like this occurs again in the future. And then the last report I'd like to just summarize a few key points out of is just came out in the last couple of days from the Bill and Melinda Gates Foundation. It's their Goalkeepers Report, which is sort of a quarterly report that they do, but this one was focused on COVID-19, a global perspective. And if you're not familiar with the Gates Foundation, they focus on health and development work in low-income countries, have put a lot of resources and training into that. So they conclude decades of historic progress in fighting poverty and disease has now stopped. We've been set back about 25 years in about 25 weeks. The International Monetary Fund projects the global economy will lose 12 trillion US dollars or more by the end of 2021. Vaccine research and development is inherently very high risk. The probability of success is 7% in early stages and 17% once candidates move on to human testing. I'm not trying to be Dr. Doom here, but just suggesting what some sort of empirically based research is suggesting of what we're facing here. The future is not a zero-sum contest in which winners win only when losers lose. It is a cooperative endeavor in which we all make progress together. And again, I think that's one of the ideas that's bringing us together on this discussion today. So the way we've planned this is that our speakers will give brief summaries of COVID-related communication behaviors and outcomes in different regions of the world. Let me briefly introduce them, and then we'll just move from one speaker to the other. There will be time for Q&A once the speakers finish their summaries, so please write down your questions and be ready to pose them when we enter that Q&A phase a little bit later. So speaking about South Asia will be Dr. Rauf Arif. He's an assistant professor of journalism and creative media industries and a native of Pakistan. Speaking about East Asia Uyanga Basa, a doctoral student in the College of Media and Communication and a native of Mongolia. Speaking about Europe, Dr. Ioana Komen, assistant professor in public relations, a native of Romania. And for Africa, Dr. Leo Echo, professor of journalism and creative media industries, a native of Cameroon. And Mexico and Latin America, Gabriel Dominguez Partida, who I introduced earlier, a doctoral student in the College of Media and Communication, also assistant director of the Harris Institute, and he is a native of Mexico. So I will just go ahead and turn it over to Dr. Arif.
Okay, thank you so very much, Dr. Wilkinson and Gabriel, for organizing this wonderful and much needed platform of discussion. Can you hear me all well? Okay, good. So I'm really thrilled to be part of it, and also see so many faces I can recognize now. Like it's who would have thought that all of those faces that we used to see are now like are nothing less than luxury, right? To see around. Dr. Camstone and I rarely see each other by the elevators. So hi to Cam and everyone else. Okay, so quick summary. I know Dr. Wilkinson said like no more than 7 minutes. So he has that magic wand to hit us whenever he wants us. So, okay, so I will talk about like South Asia in general and Pakistan in particular. So as we all know, like majority of the population, particularly youth population, lives in South Asia now, right? That's one factor that I realized, in addition to not acknowledging the role of media and communication, we are also like not bringing these things in discussion where youth and their overall like contribution can actually either play a very positive role in overcoming these kind of pandemics, or it can actually cause some problems if they are not organized, or if they are not more motivated to make sure like we are trying to achieve a common goal. So Pakistan's population first. Pakistan's population is little over 220 million people live there, right? Youth, in terms of like their, I would say like their average age group is 22 years old, and people over 65 years or closer to 65 years, it's like around 4% population of the country is 65 years. So which means Pakistan is in general is a youthful country, I can say that. The next door neighbor, Indian population like is, if I'm not mistaken, I believe it's 1.3 billion people live in India. Now the cases comparison, like of course, like then Bangladesh and then Nepal and Bhutan, they are also like significantly populated countries. But just trying to wrap up this discussion on these two densely populated countries to see like how they are handling COVID-19. So when COVID-19 started in Pakistan, for example, it was very devastating situation. Military and civil government in Pakistan, they were not aligned. So they both had like different idea how to handle it, because Pakistan is poverty-stricken country, right? Majority of the population, little over 65% population, have to rely on daily wages. So our civilian rule was saying like, if we try to lock down this country, people will die either way, die of starvation. So why should we do it? Military, on the other hand, was very much concerned, like if we do not take measures, like things can go out of hand. So that was the initial stage. And then eventually, once both of these executive powers, they developed a common sense that we have to move forward somehow. We have to try to save the population. Then media role became really significant in Pakistan. I had been studying news media role in Pakistan for a pretty long time, because I worked as a journalist in that country for little over 7 years before coming to the United States. But I never thought like media can actually play a significant role in this case. So we saw social media we saw electronic media, particularly broadcast media, news channels. And then we also saw like artists, singers, they started coming along with this message. One of a very famous singers in Pakistan, himself is pretty young guy. He was actually one of the best kind of like resource to mobilize youth about not only about disseminating the message that coronavirus is something to take serious, because in a country like Pakistan, where education, poverty, and so many health related issues are bigger challenges, it's hard to convey that message. So he started writing some funny songs, humorous songs, and then he started like singing those songs, and like those songs started becoming like talk of the town. So that was the one way, and our TV channels were promoting him. And at the same time, whenever his videos were posted on social media, people would reshare just for the sake of fun. But on the other hand, the message was getting through pretty quickly. So then overall society started developing a little bit more of a common sense, like, hey, this is a serious issue. We have to think something about it. And then government, then it did a fabulous job by utilizing three-pronged strategy. So one was asking people voluntarily wear masks and try to protect yourself. Second, if they are not doing it, they would impose these measures, these SOPs on people. And then also, like, if people are not following, they were being fined or punished by different legal ways. And third, media and communication, particularly television media, was doing an amazing job by promoting this message. Of course, there was culture of fear for quite some time, when particularly we were being compared with with Brazil, for example, the way like things were getting worse. But overall, at some point, a common sense prevailed in the society, and we started seeing the curve has started to flatten. So now there are different arguments and criticisms that I will also want to throw it out there. Some people are saying like the testing is not being done as aggressively as it is being done in several different parts of the Western societies. The other kind of like criticism is how much can we trust data coming out of Pakistan, right? So I'm just throwing these things out there for discussion later when we get back and start talking. Now, India is still going through this curve after, I think it's the second highest in terms of like coronavirus cases numbers in the world right now. Part of the reason India is so big is cities are densely populated, and then there are other factors as well, right? So we will definitely talk about that when we have Q&A session. I just want to see if I'm missing anything important. So I would say, like, to recap, that media, social media, like traditional media, social media, and artists, they played a significant role in promoting this message of common sense, that it's as Dr. Wilkinson said, like it's not a zero-sum game. So we have to work together to save the humanity, to save societies, and try to make sure like we defeat this pandemic. So and that's still there. This effort is still going on over there. Dr. Wilkinson, that's what I have to say, at least for now.
Your timing couldn't be any more perfect. You were right on the button. So thank you very much for that, Dr. Arif. And now we will turn to Uyanga Basa, talk about East Asia. Thank you.
Thank you, Dr. Wilkinson. Thank you, Dr. Arif. That was really interesting to hear about Pakistani case. So just to visually assist, I put together a few images from Mongolia, the country that I'm gonna talk about today. So if I can share my screen, Dr. Wilkinson, I can go through the slides as well. It says host disabled attendee screen sharing.
Yeah. Can you change that, Gabriel? Thank you. Should she try again?
Okay, great.
Thank you.
Okay, can you all see my screen? That's great. Okay, so to briefly introduce myself, my name is Oyanga Baza. I'm a third-year doctoral candidate at the College of Media and Communication. Representing the Northeast Asian region, I will talk about how Mongolia has been handling and communicating COVID pandemic to its population. The reason I'm talking about Mongolia's case in terms of its communication efforts is because, one, I have been following it closely since the pandemic started in March. Two, I'm also personally affected by some of the government's decisions. So again, to give you a bit of background about Mongolia, it's sandwiched between Russia and China. It transitioned to democracy in 1989. So it has been 30 years since the country has been trying to internalize democratic values such as freedom of expression, human rights, and equality. As a neighboring country to China, where the virus has originated, Mongolia took really drastic actions early on. According to this article published in May on medium.com, as early as late January 2020, Mongolia announced that first it will close schools and universities, so that was in January. Also, it's going to prohibit public events and restricted vehicle crossing, among many other actions they announced. As you can see in the title here, Mongolia was basically hailed in this article for its leadership and prompt action that resulted in zero community spread. And this article was in May. So today is September 16th, and Mongolia still does not have a single COVID case that is contracted internally. Last I checked, there were 311 COVID cases are registered so far, and all of these cases were imported and zero dead. So this is one side of the story. The other side of the story is that there are tens of thousands of Mongolians who are stranded abroad. Now it has been for half a year. The government of Mongolia locked down its borders in March 2020. It canceled all international flights in and out of country, and it still remains that way today. People who left the country to attend, let's say, 3-day conference in Japan, for example, they could not return home for months. Mongolians who went abroad to get health medical treatment, people with small children, pregnant women, they couldn't go home. I was planning to return home in May, and I couldn't make it. My ticket was canceled. I couldn't make it to the charter flight the government of Mongolia has been organizing on a monthly basis to repatriate Mongolians. If I were in DC, Washington, DC, I would have been joining these people who are staying on the street. Mongolians who are stranded abroad for months protest outside the Mongolian embassies around the world and international airports. This is Seoul Incheon International Airport in South Korea. People sit all day outside. Some of them sleep outside the embassies. This one is in Seoul, South Korea. While Mongolians who are stranded abroad are trying to enter their homes, the government is creating this bottleneck for months by bringing only a few thousand people, from 1,000 to 3,000 per month, and putting them under state-run quarantine 21-day facilities. My mom was also in France. She was stranded again for 5 months, and last month she finally got home, and she had to stay in a state-run quarantine facility for 3 weeks. Those who cannot make it to the government-run charter flights are questioning the inefficient management of repatriation process, spending the pandemic relief funds the government of Mongolia has been receiving from international organizations, and basic human rights issues to travel freely and return home. For the past 6 months, Mongolia repatriated about 6,000 Mongolians, and there are still tens of thousands of more people who are waiting their names to be picked for these very few charter flights. So against such a contrasting backdrop, the government has successfully adopted and been implementing 2 communication strategies based on my observation. So those 2 messages are, the first one is fear appeal, the second one is nationalism and pride. So how they do that? This is an image from a daily 11 o'clock briefing organized by the National Emergency Committee, consisting of the Department of Health of Mongolia and FEMA officials, right? During these briefings, government officials provide how technologically advanced countries such as the United States, the UK, and Japan are failing to save their people's lives and feeling utterly powerless. These briefings assisted with video, audio-visual materials that are really full of fear appeals. To showcase how Mongolia's handling of COVID-19 has been superior to the rest of the world, this chart is updated and shared with the public on a daily basis. On the right-hand side here, you can see it shows how COVID cases have been exponentially growing around the world. And from the left-hand side here on yellow backdrop, you can see Mongolians can be informed on how many imported cases Mongolia have, how many are hospitalized, and how many have recovered. And there's 0 death. So this rhetoric in the national news spills over to social media spheres. People make memes of this man, who is the director of National Center for Infectious Diseases in Mongolia. In the bubble, he is depicted saying, oh, there's no community cases are registered, imported cases have recovered. So it really gives this sense of Mongolia is being superior and doing really well. The government is really managing well the whole pandemic issue. Even his mural is painted on a large residential building in Mongolia. And here he is basically posing in front of the mural. And such rhetoric really is an opportunity for the government to bank on public support. In June 2020, Mongolia held its parliamentary election, and the previous government, previous political party that governed the country between 2016 and 2020 was re-elected. So politicians were campaigning, hugging, holding hands, and taking selfies when the country was in a quarantine mode. The public was advised to socially distance, wash their hands, and not to gather in groups. But as you can see, politicians are completely going against their own advice. So these are some photos. The government of Mongolia successfully organized the election in June. This photo is from July 2020. Mongolia celebrated its national holiday, the equivalent of Thanksgiving or July 4th in the US. So for the first time, our national holiday was celebrated at a private resort owned by our president of Mongolia. So politicians again attended the holiday ceremony, whereas the public was advised to stay at home and enjoy the national holiday through the television screens. Throughout these months, shops, pubs, restaurants, cinema were shut down. Supermarkets and convenience stores had 10 p.m. curfew. Due to all these restrictions, the economy has been suffering, right? However, the mayor of Ulaanbaatar, the capital city of Mongolia, decided to build a fountain in January 2020. This construction project costs about US $1.2 million of taxpayers' money. However, politicians prioritized construction project over a global pandemic despite the public unrest. Here you can see the Mongolian public continues to organize themselves and voicing various issues. Online environment. Here's an example of various Facebook groups. So you can see Mongolians who are stranded abroad that has 26,000 members here. And then it goes Mongolians stranded in Europe, Mongolians stranded in the US, 2,700 members, etc.
Okay, we need to move along now, so if you could finish up.
Yes, so to really wrap up, recently our 11 o'clock government daily briefing has had a facelift and changed their background. As you remember, this is the previous one. And someone on Facebook criticized by saying that, why does a daily briefing has a backdrop that is more appropriate for international summits? This is just pretentious. And someone commented by saying, it looks like a North Korean news broadcast. And he posted this photo. So to sum up, COVID has not only a public health threat in Mongolia, but also democratic values test. It's one story that the government tries to tighten its grip on the public. However, it's the whole other story whether public accepts or opposes the tightening of regulations, violations of basic human rights and authoritarian types of governance. I'm happy to take questions during the Q&A session. Thank you.
Okay, great. Thank you. And please, Dr. Komen.
Hi, thank you everyone for being here. I'll briefly touch on general things about crisis and risk communication in Europe, and then some examples from Romania, and then we can definitely talk more in the Q&A. So overall, the European version of the CDC called ECDC, as of today, in Europe and the UK, we have 2.6 million registered cases in total. And out of this number, Spain is #1 in the number of cases, France the second, UK the third, Italy the fourth, Germany the fifth, and then Romania on the 6th place, so still top 10. And then over 184,000 deaths, also in the European Union and UK. UK leads in this number, followed by Italy, France, Spain, Belgium, and then Romania is #9. So it's still within top 10 in this sense. While like Dr. Rauf said, there was a positive side to all this pandemic communication. People did come together on social media. You had countries like in Italy, Romania, France, where you saw the singing out of the balcony and made national and international news. There were communities online and on social media formed in terms of solidarity and trying to help each other kind of cope with the pandemic and with the quarantines when those are happening. However, if we analyze this and take a look from a very crisis and risk communication standpoint, in terms of how these different governments and different official actors communicated and dealt with the crisis, managed this crisis, the results are not so positive as of now. So what this showed us, first of all, is that many of these developed countries where we wouldn't have ever thought this would be such a big problem were actually ill prepared. They were not really prepared for the virus. They were not really prepared in terms of crisis management, crisis communication. And at least at the beginning, they were pretty complacent or seemed complacent with the effects. You also have to realize that in terms of pandemic communication, you're dealing with two different things. You're dealing with risk communication and crisis communication, right? So at the very beginning, if you remember, we were trying to prepare maybe for, okay, what do we need to do in terms of risk if it comes to our country, right? If it comes to Romania. At the very beginning, it was just something that was happening in China. But then as things were getting worse and worse, then you end up in this crisis communication type mode. So it's challenging for these actors, for government. And it's clear that they were not, they didn't have any plans in place. So the initial crisis communication was very slow across Europe. The news that the novel coronavirus has been detected in the Chinese city of Wuhan, that happened on 31st of December, 2019. And it really was just mediatized more than anything. It was coming from media and then some were reporting it as a rumor. For many, the perception was that this is something of little significance. It's something that's happening somewhere in China. Why would we care even about it? And so in terms of initial communication, The World Health Organization was slow. And then within Europe, France, Italy, Romania, Spain, UK, and many others made early statements that downplayed the threat. For different reasons, and we can talk about more about that in Q&A, but they downplayed the threat. Either it's not gonna come to us, it's gonna stay probably somewhere in Asia, China, or it's not so bad anyway, it's probably just like the flu, or maybe a bit more than the flu, but we have no reason to worry or no reason to panic and do anything else. In terms of Europe as well, the European Union was also slow to communicate, and they were slow in establishing policies or kind of giving directions to all these countries on how to have a coordinated type of communication or policies. Then, you know, things got really bad, obviously. But then the other problem you had from a communication standpoint was that you all of a sudden had very contradictory and confusing information and messages coming from all these different actors, right? So by the textbook in crisis communication, what we always aim at is to have a very coordinated, very clear messaging, very clear strategies, and all they should be clear and coordinated within a nation's main institution. So like the governor, the government, the Ministry of Health, or whoever deals with it, but then also internationally, right? Within the European countries, EU and all that, which did not happen in this case, at least at the beginning. So it wasn't really a strategy. Every nation was kind of left to figure out their own at the European level. You had different official actors, which made things worse, like ECDC or the WHO or health ministries in different countries, where their information was contradictory. So one actor would be saying, oh, this is nothing, you know, you don't need to worry, you don't need to wear masks. Other actors would be, no, you really need to have masks and stay inside and do this and this and this. So you have the populations left to figure it out for their own. And then the other problem here too is that because this happened, for example, in Romania compared to Mongolia, initially it was downplayed. Then you had a lot, because of all these other hotspots, right? They were already happening, like Italy was a hotspot already, Austria was a hotspot already. Romania has a lot of Romanians who work in all these different other countries. And so all these people, hundreds and hundreds and hundreds, were coming back to Romania because they were being kicked out essentially by, you know, the jobs were closing and the countries were kind of kicking out anyone who doesn't live there permanently. So they were coming back to Romania, and initially there was no real messaging on how to deal with that. And then later on, they tried something similar to what Mongolia tried. And so they tried to have a campaign telling people who are still abroad to not come back to Romania. Easter was approaching, which is a big holiday for us, to not come back to Romania in order to protect their grandparents and protect their parents, because as they were coming back, there were no policies in place for anything. They were just at the border, they would just be asked, are you sick, yes or no? Okay, fine, but you know, you should probably just, as you would reach home, you should probably just not go out anywhere for 2 weeks, which no one was really respecting anyway. So that was a big problem. The other big problem, and that's, I think, true across the world, unfortunately, was this, what the WHO calls infodemic issue. So you have misinformation, disinformation, fake news going absolutely insane across Europe, everything from fake cures to the 5G conspiracy type thing. I don't know if you heard about that. But all this stuff had real consequences. It had real consequences from people trying all these like weird cures and treatments that ended up actually getting them to the hospital, like drinking raw juice, garlic, something. But also in the UK, you had people and mobs who would go and burn the 5G towers. In Romania, you had people stigmatizing other people. At some point, there was a rumor on how certain migrants are bringing the disease. The same, I think, I have it written down. The same thing happened in Hungary. In Hungary, one of the officials actually said that the migrants were the cause of the spread. So then you had a lot of stigma and a lot of bad things happening. And so really the worst result in this sense, at least at the beginning, was that you had very confused people, very confused publics who weren't sure who to trust anymore because you're getting bombarded with all this different information. And then you had a big, like in the US really, a big divisiveness. And that happened in European countries as well, definitely in Romania. So you had the groups who were taking this seriously and trying as much as possible to figure out how to prevent things and take measures and help with the situation. You had big groups who were not believing that this is anything real. And so like here, they would go and protest. And then you had the extremes and the psychosis, at least in Romania, that was created because of all this stuff, where you had people who actually they would have needed a doctor or they would have needed help, but they were so scared of even leaving their house that they ended up dying of totally unrelated COVID causes, like heart attacks, or someone needed their insulin, but they were afraid to go out of the house, or they were afraid to call anyone. At some point, the rumor in Romania was that if you even call to ask for any medical help, including, you know, wondering if you should get tested, that the next day the ambulance and the army comes and takes you away, and then no one ever sees you again. So there were all these things that made everything worse from a communication standpoint. On the flip side, you also had some positives, and at least it seems that now they're trying to like figure it out and have a more clear messaging, coordinated. The European Union is stepping in generally as a kind of like overseer, but we don't yet know if the damage was done, and this is not over yet. So it's hard to see like what was successful and what was unsuccessful. There are information campaigns like in the States going on. So I think we will have to look at this, you know, for the next year or so to have like real conclusions. Thank you.
Okay, thank you very much. Appreciate that. I hope you all understand the challenge in summarizing such, you know, large and diverse areas, but we're doing the best we can with it. And along those lines, we've asked Dr. Leo Echo to talk about Africa, another area. What is it, like 54 nations, and very hard to summarize, but please do the best you can. And his label is different, but where it says Mola Livio, that is Dr. Leo Echo. So I'll turn it over to him.
It's just sorry, it's my nickname. I couldn't log in through the regular regular Zoom, so I'm using my private email. Okay, thank you. I hope everyone can hear me. The main story, there are 54 countries in Africa, of course. The main conclusion one can draw is that COVID helped to reinforce neo-patrimonialism. And neo-patrimonialism, that's a system of government where there's a very powerful executive, powerful president, and uses a crisis to reinforce positions of power and and patronage. So that's so the COVID was a godsend for a lot of authoritarian governments. So the first thing is that some of the authoritarian regimes said, "Wow, the apocalypse that was predicted that will sweep over Africa through COVID has not happened." That's the first thing. So these people hate us. You know, we are here to take care of you. The foreigners think that we are all going to be wiped out. Hey, we are still here. As a result of that perspective, a number of countries, I'll tell you, for example, in Cameroon, where I come from, the government ordered a lockdown, and complete lockdown, no bars, no churches, no public transportation, no nothing. And the brewery industry is one of the largest, the beer industry over there. Drinking beer is like a national pastime. The beer company, which happens to be French, Les Brasseries du Cameroun, started losing money. And so they leaned on the patrimonial leader, and they said, hey, listen, if you don't open those bars, we're not going to have money to pay taxes to you, and your government is going to go bankrupt, and you are going to have a revolution on your hands. Less than a week after the lockdown, the government came up with an order. All the bars are now opened. And people were all out in the streets rejoicing with their beer and so on and so forth. That's the first thing. Number two, again, patrimonialism, the government closed the airspace, but it allowed only Air France, the colonial power, to fly, with some people who were stranded, to echo what I hear from Mongolia and other places. There were some Cameroonians who were stranded in France. And so there was a chartered Air France flight. It just so happens that some of the people had COVID. So the government said, okay, you are going to come, you are going to be isolated. But the government had no place to put them. So the government ordered, again, the patrimonial government ordered some hotels. you are going to host these people and keep them in quarantine for 2 weeks. But the government did not tell the hotels beforehand, it did not pay for it. And ultimately, some people just went to the hotel, and at the end of the day, they were there for a few hours. They just took their suitcase and they took a taxi and they went home. That was the end of the quarantine. And of course, the powerful people, the relatives of the political leaders, did not even, they just ignored the quarantine. So, and then we had skepticism generally about COVID. A lot of people in many countries, oh yeah, this thing is imported. It's from China. It doesn't kill Africans. Until we started hearing news about African expatriates in France. There's a big African community in Europe, in France, and we started hearing some of our best musicians. Manu Dibango died of COVID. We heard about writers and musicians and intellectuals. Then people started paying attention. And still, but the government still continued its neo-patrimonial policy. The Minister of Health will come and say, oh yeah, this is not a serious thing. It's not as big as people think it is, and give a few numbers and then go home. But the hospitals were not reinforced, so some people died. The hospitals were very, very poorly equipped. And then the WHO, at the very instance when the Trump administration said it was going to cut off funding from the WHO made a political move in order to get this, maintain the support of many African countries. They sent out very expensive cars to the health officials in the ministries of health. They didn't send test kits, they didn't send respirators, they didn't send anything for the hospitals. African hospitals are just bare bones. So the WHO played a political game in order to maintain the support of the country. So the media said, what is going on? The WHO is sending a dual message. It's saying that we must all be careful about COVID, and this is in action. They are sending expensive cars, which will be driven by the director of health, the director of so and so, but the people on the street never got any benefit. And then again, to continue our new patrimonial theme, I'll take you to Tanzania. The government of Tanzania, the President John Magufuli, he said, this is a foreign thing, they're deceiving us. So he did his own test of the test kits. A lot of the test kits for COVID were imported. So he and a few technicians and doctors played a trick on the testing center. They took samples from a goat, from a pineapple, from a couple other fruits, and they sent them to the testing center, and they all came out positive. And then the president went and said, see, I told you, this is all a joke. That was his counter communication. So he came up with a counter communication and says, these are all, it's all bogus. So he just threw doubts on the whole testing. That was it was part of this new patrimonial system of control. He wanted to show that, hey, we can do better than those people. And then in Madagascar, the government, the president himself came up with his own cure. He called it the COVID organics, which he was distributing. He went on TV everywhere. He was distributing everywhere. And so because he is the president, the powerful, everybody believed. People were just drinking that stuff like nothing else. And it just so happened that ultimately COVID went to Madagascar. He said it was a cure. But ironically, up to today, Madagascar has less than 200 deaths from COVID. They have like 6,000 infected people. And then there's skepticism about vaccines. A lot of counter communication went out about vaccines because there was a French, two French doctors for the equivalent of the National Institute of Health in the United States. They went on TV and they said, okay, we have a candidate vaccine. Let's go and try it in Africa like we tried all the other vaccines before we bring it back to Europe. And that was big in the media. Oh, so you want to use Africans as guinea pigs? So everybody, the media was saying, we don't want any vaccine. We don't want any vaccine. Of course, the doctors ultimately went on French TV and apologized. But the World Health Organization Director General Theodoros Ghebreyesus, he said this is a hangover of a colonial mentality. So now the COVID vaccine has now become associated with colonialism. And so people are very, very, very skeptical. So the moment anyone talks about a vaccine from a Western country, people just laugh at you and say, oh yeah, you think we are guinea pigs. So that mistake, because the French National Institute of Health, they forgot about globalization. Immediately he went on TV and talked about testing this vaccine first in Africa. It was all over social media. It was in Facebook. It was translated into all kinds of languages. And so there is a heavy, heavy skepticism now in Africa about any kind of vaccine for COVID, any kind. So that was a really serious miscommunication. And so ultimately then, even the COVID in Africa became part of the geostrategic struggle between the Trump administration and China. This is what happened. After the first wave of the COVID went down in China, China closed its borders. And then someone in China said the COVID was brought by immigrants. And so there are a number of African immigrants in China. They were kicked out of their apartments. They were refused entry into supermarkets and so on and so forth. So the American ambassador in Beijing and the consul in Shanghai, since some African Americans were involved. Some African American, the Chinese did not know the difference between an African and an African American. So they barred everybody. So the American ambassador in Beijing came out with a note and said, warning all African Americans, be careful, they are discriminating against you, they think you are a carrier. And then of course Trump tweeted it from his tweet. So see what the Chinese are doing, they are racist, this is what they are doing to Africans and African Americans. So it became a part of this back and forth, this geostrategic struggle between China. And so people in Africa became very, very anti-Chinese. We have millions of Chinese in Africa right now. There are Chinese, and also the papers reported all kinds of reactions against Chinese. Some Chinese businesses were attacked. Some countries like Zambia, they expelled some Chinese. And so again, ironically, some Chinese citizens in Africa were blocked from going back to China because China closes its borders. And so the Chinese expatriates living in Africa could not go back. So they also had to struggle like everybody else. So they became caught up in the middle. They had a really negative reaction from Africans and a negative reaction from the United States. And then their government wouldn't let them back in. And then that's one side of the story. And then we had millions of Africans who got stuck in the Middle East. Many Middle Eastern countries couldn't come back because the borders were closed. So we saw, like Uyanga showed us, there were Africans living in warehouses in Beirut, in Kuwait, in the airports and so on. And some of them are still there to this day. The governments just could not do anything to get them back, or they didn't have the means. But on the reverse, I know my time is almost over.
Yes,
on the reverse, okay. On the reverse, the neo-patrimonialists, the elite, had a way of going out, taking their families out. For example, the Israelis in Cameroon, the Israelis are training a very brutal military brigade in Cameroon, which is fighting separatists. And so they had a standby plane, and the big bosses could leave the country, and somebody leaked a flight manifest of the Israelis and the heads of flying their families outside of the country to Israel and other places. So it was this uneven situation. So the COVID, in other words, exposed neo-patrimonialism across the continent. You can use that theme and see how it applied from one regime to the other, and it was all the same: unequal systems and colonial systems, poor health systems, and so on and so forth. That's all I have for now. Thank you.
Okay, thank you very much, Dr. Echo. We appreciate that. And now we'll turn it over to Gabriel Dominguez Partida to talk about Mexico and Latin America. Gabriel?
Well, thank you so much. Well, indeed, I think that many of the different issues in communication that we have heard until now are replicable in the case of Latin America. I will say that there are several different models in Latin America, but they are very similar, or at least the case that I'm more familiar with this, which is the Mexican case, is something very similar to what happened in the US. I will start with that case, and I'm going to move to the others, in the sense that just to see in which place is Mexico located right now in the number of cases. Mexico is number 4 in Latin America, being Brazil the country that has, unfortunately, the major number of cases, around 4 million cases, when Mexico has around 600,000 cases. So what happened in Mexico? I think that one of the strategies that they implemented really well is we need to understand that Mexico had a history of facing pandemics. In 2009, when the swine flu was occurring in Mexico, the government understand how to manage this kind of health crisis and which kind of messages they can start spreading. So what the Mexican government did from case number 1 was implementing a daily conference, just to talk about the situation in the country. So people that is familiar with the case of Mexico will understand that we have a daily conference from the president, that it's in the morning, and we have also a daily conference from the health deputy minister in the afternoon. So during the whole period of the pandemic, one thing that starts to happening was the health deputy minister was informing the audience about all the novel situations or all the novel perspectives about coronavirus around the world. The problem is that when you have very volatile information, when you have information that it's not really accurate because it is evolving constantly, you start making several assumptions that are going to be contradictory when times start moving forward. So media start doing that. They start highlighting all the contradictions that the health deputy minister starts saying in that conference. And they were saying, okay, well, it seems that he doesn't know how to handle the situation. And if you add to that equation that the president was minimizing the damages about the pandemic, and he was saying, hey, don't worry, you don't need to use a facial mask, you can go wherever you want, you can even hug other people, don't worry about that. So you have different messages. And when you have different messages and the population doesn't understand what is happening, what is the real thing, they start just leaving aside the official information. And one thing that occurred in Mexico is that there was a lot of conspiracy theories behind this misinformation process. So they start relying in things that emerge from social media. In the sense, for instance, from ridiculous cases in many ways. For instance, they were saying that doctors were paid for the government just to register more number of cases in order to access to financing from World Health Organizations, or that people was hospitalized just to steal the liquid from their meals because they sell that liquid in the black market. Some of those ridiculous situations were part of the discourse on social media. And when you don't have a straight line that is giving you an accurate information about this, I think that in the end, this kind of crisis occur. What happened as well? Well, it occurred a fragmentation within the country, in the sense that the different states start seeing that there was not a real strategy from the national government So they start implementing different strategies and different strategies of communication. If the government says, no, we are not going to apply quarantine, so many states said, no, here quarantine is requested, and you will be under quarantine more weeks that the official government is saying. So the topic becomes something polarized and politicized. When you politicize something, I know that this is not a place to discuss about politics, but in the case of Latin America, I believe that politics became the way in which the strategies of communication were adopted. And many people start saying, well, if you are not listening to the official communication, it's because you are against the official party or against the party that is in power right now. We have another cases in Latin America that did some different strategies. For instance, in the case of Argentina, we have the opposite. We have an alignment of all different levels of government. They have the same kind of communication, and there is only one way to communicate that information. And when you have these kind of approaches, we have at least the outcome of a country like Argentina has been, or Peru has been a little bit better than how other Latin American countries have handled this communication. What happening in those countries as well, we need to understand that the social differences between the wealthy classes and the poor classes, it's something that many different media uses as a discourse to encourage or at least to highlight how poor populations are the ones that indeed are more affected by how the pandemic is having or is being occurring in the country. So mostly, I will say that it is replicating so many of the comments that many people have said about the different approaches of communication. In the case of Latin America, the extreme has been Brazil. If we compare Mexico with Brazil, we can see how even the president of Brazil was like disregarding any kind of health communication by saying they don't know exactly what they are talking about. This is just like the flu. And we are watching now the consequences of that case in the sense that they have 4 million cases. And even he's feeling the pressure of people which is demanding him to adopt the health measures that international organisms are proposing. So that's pretty much the panorama. I don't want to extend more this conversation because I think that for the sake of time, it is better to have to open the mic. I don't know if Dr. Wilkinson is supporting this in the sense that I prefer that people start asking questions so we can grow this conversation.
Agreed. What sorts of questions or comments do people have?
I have a question.
Please.
Okay, so like, how do like international like students, like for example, that go to tech, like how does like the like time zone, like how does that work? No.
You mean in terms of communicating?
Yeah, like their classes, like how does that like work with like different time zones?
For synchronous classes, yeah, they're going to have to, be up at different times of the day in order to participate, which is part of the reason that we try to do asynchronous for some courses so that it doesn't really matter what time zone you're in, you can do it on your own schedule. But yeah, if you're in, Europe or Asia or, places in between, you're going to be at off hours from our regular class schedules here.
Okay, thank you.
I have a question too. So with every single different country and every area, a lot of it was enhanced because of media. Is there any way to be more proficient with the media that is put on the internet or like within Twitter or things like that? because of the memes that they put in Mongolia. There's things that are making people mad and stuff like that. Is there any way to avoid that, or will that always be the case now with the amount of social media that we have?
Good question. Let's hear from our speakers.
I think, yeah, especially about memes, you know, people expose themselves to information that they tend to agree more. So depending on their own belief, they not only consume information, they also create content and spread those information to people who tend to agree with them. I think that's really the case from now on. There's no way that we can regulate or stop people from consuming fake news or disinformation and misinformation. There's only way for them to really understand is through education, media literacy. But again, really the COVID has exposed weakness or vulnerability in our media system, and as well as the public, how lack or little information or education they have about media, what kind of content you could use and how you can be affected by those.
Yeah, sorry, go ahead.
Oh, well, I'm sorry. With that being said, what is the best way to know what you're looking at is actually correct for what it's put on? I know we always learn about it, and we talk about it, the dates and who put it out and when and what's in it, but what is the best way to know what's correct and what isn't? And even if the government puts it out, sometimes that might not be correct, or how do you just have to read everything and make your own inference, or what would you do with a situation like
yeah, again, your example about, let's say, governments, right, being an information source. In countries like Mongolia, people tend to believe the government or Department of Health, but the Department of Health or doctors themselves may not be well informed about recent development of COVID and vaccine. So without intention, they either intentionally or not intentionally, they could be spreading false information. So it's just really about, okay, we are living in this environment that is really full of information, that new information comes up every hour. So we need to always question. Is there some competing agenda or competing voices or opinions have been, you know, put forward that I was not being exposed before? So it's just an ongoing process, I think.
Yeah.
Dr. Yes, Dr. Leo, and then Dr. Arif.
Okay. Generally speaking, people are very skeptical. I approach this from the neo-patrimonial perspective, where the government knows everything. The government, it's always a top-down diffusion of information. And the government diffuses information that puts it in the best perspective, in the best light. It's in charge, it's benevolent, it's doing, the president is even distributing things to poor people. It's always from that perspective. So as a result, we also have a counter communication. We have people who try to subvert the official dialogue, the official narrative. So that, and they do that mostly through the social media, because the official government media will always give the official government perspective. And sometimes the government perspective is ridiculous. Like I just showed you, I told you the example of Tanzania, where the president set out to prove that all the COVID tests are bogus by sending samples from pineapples and fruits to have them tested. I mean, he made it. That was the official, that's the president of the country. So of course we have counter communication, which came in the form of, we had some cartoons. The cartoonists made fun of the government. And then of course, a lot of social media counter communication. So the average citizen has to be media savvy. Like Uyanga said, you have to have some media literacy. So you have to know that you don't just rely on the government source, on the opposition source. but you compare different media sources in order to decide, understand for yourself what is going on.
Yeah, both are great points. I think Simon raised a really interesting perspective, which Oyanga and Dr. Echo have already addressed, about like the whole idea of fake news. Like earlier, last year, I remember we sat on a panel in Student Union building, and the fake news was all about politics and stuff. Now we are talking about like COVID-19 or these pandemics, which this pandemic is essentially becoming a twin-demic pretty soon. That's another like buzzword that's spreading in the market, like with flu and like corona. So yes, media literacy is a very important aspect. I just wanted to add one more thing to Simon's point. It's social media is, of course, like it's part of the problem. At the same time, it is part of the solution. So what happened in a country like Pakistan, where people in the beginning were not listening to the message, they just disregarded. Like many other countries, like Romania and several other countries, they were thinking, well, it's not going to affect us. We are all right. It's just, even though China is next door neighbor to Pakistan, but still they were not taking it serious. On social media, when there were like counter communication related arguments taking place, one good thing happened, and that was the engagement part of it, right? Earlier, people who were disengaged from these conversations, when they were challenged in one way over the other, right? Even if they were sportive of taking measures against coronavirus, or on the other side, like they were just negating it. Once they were challenged, they started, because I saw recently, I was involved in a study, like it was a longitudinal study about Pakistan, where they studied like Twitter, and most of those tweets were like basically a long thread of interaction taking place. People were challenging, negating each other, getting involved, and that's how the message, the communication, that was like getting spreaded around. So of course, like social media sometimes is more challenging in some cases, but on the other hand, it can actually be a mobilizing tool that can carry over the message. Hey, there is a big elephant in the room. Even if you don't want to deal with it, it's still there.
And then I also have one thing to add to Simon's question that maybe will help you in that sense of like, what can you do? One of the actors of watchdogs, if you want to call them that way, that is really actively trying to fight all this misinformation, disinformation, fake news, are these organizations that are or exist solely for the purpose of fact-checking. So they are called fact-checking organizations, and they really mobilized, and they have a whole alliance now. Actually, me and Gabriel are working on a study regarding that, and they are trying to actively use social media in order to spread these fact checks, right? To essentially respond to misinformation, and they'll have all these different posts and try to be engaging, saying this is fake news, this is misinformation, this is not true, and they are built or meant to be. Now, of course, there remains to be seen how much not influenced they are, but they're supposed to be these neutral organizations acting as watchdogs, because the misinformation and disinformation comes from all these other sources, and not just from like your fringe crazy actors, but also from official sources, like, you know, including country presidents. So that's another thing, like try to find those who are actively fighting this and have those in your social media mix, right? And see what do they say. Because at least in theory, they are there and supposed to be neutral and have teams of scientists and all these other experts coming through all this information to figure out what's fake and what's real. And the other thing, Simon, to remember is that with some of this, the science itself changes. That I don't think publics realize how sometimes that's the whole point of science, right? Like masks versus work versus they don't work. Who should wear which type of mask? I mean, all that is new information.
I would encourage students to think about this in terms of what they already know sort of domestically. We're seeing some strong parallels with what's going on in the United States, which, you know, we're assuming you're paying close attention to. And also, you know, to tie it to some of the concepts that you may be studying, like the marketplace of ideas or the public sphere, right? this coming together of ideas and people having to negotiate with them and communicate with each other to try to sort of filter it out is very much what that's about. So that theory isn't just up there on the shelf academically, it's very much, you know, involved in these day-to-day interactions that our speakers are talking about. I know we're getting close to 2:15, but I'm willing to keep it open longer if people would like, but let's get at least one more question in before some folks might have to go.
I have a question.
Please, Anna.
So I was actually curious this whole time about like how places like North Korea are handling these situations, and how like just places in general where the public doesn't have a lot of autonomy when it comes to their media and global information and stuff.
The way I look at that is, so Korea is one of those success stories, right? How to handle the pandemic. They started wearing masks very early on, and also technologically they were much more advanced. They started testing and make drive-through testing available as quite early. I think one reason is that it has something to do with the culture itself. It's a very collectivistic culture. And although it's a democratic country, people do things one for each other rather than putting their own freedom to be different or unique. They put it to a secondary, and they think in terms of, okay, for the sake of my community, my family members, friends, and colleagues, I need to wear masks. So that is something that we observe throughout collectivistic cultures. And if anyone wants to add other observational explanation, feel free. But my idea about that is it has something to do with the culture dimension of a country.
Yeah, I think in the case that you cited specifically, North Korea, it's really kind of hard to know because information is so tightly controlled, and there is a very, very strong security state there, so it's difficult to get information that isn't sort of sensed, like from satellites or maybe through some kind of espionage. But it's really hard to know, and to honestly to take statistics that are provided seriously, because there have been examples in the past, of sort of downplaying the effects of famines and incarceration levels and that. So it gets very difficult with those very strongly authoritarian states. Anybody else?
I think North Korea had one case. They said they had one case of someone who crossed from South Korea, and they said that was their very first case, and so they quarantined the whole city because of that one person. And you can do that in a totalitarian state, in an authoritarian state, where the government can pass an order and say, okay, nobody steps out of their house in the next 3 weeks, and that's what happened. Because you step out of your house in 3 weeks, you get into serious trouble with the government. Democratic governments have a hard time doing that. Like the United States, where we have had this flare-up of the pandemic, we've had demonstrations on the streets. And so in a democratic country, you cannot behave like North Korea, where the government can pass a decree and say anybody who is seen out in the street will be shot. So because of the political cultures of different countries, the pandemic has had, the spread has been different, so to speak. So you will see really, really authoritarian countries who can clamp down on the citizen at any time. Those have been more successful, so to speak, in controlling the virus. But democratic systems where you trust the citizen to regulate themselves and to control themselves, to be responsible and wear masks. Those who don't want to, they're not going to be sent to jail because they don't wear a mask. That affects the way the COVID is handled by different countries, or how it spreads.
Is there another question?
I have a question. For how long do y'all think these precautions we're talking about are going to be around, and which country do you think might keep these precautions longer than others?
I can add something about that, and probably from the perspective of Latin America, I believe that it was one of the main concerns, in the sense that there is a lot of people that cannot take the luxury to be in their home by a prolonged period of time, in the sense that they are living day by day. So they need to go out, they need to earn some money daily. And in the basis of these disparities, it's difficult to say when it's going to be in a specific moment when everything is going to be controlled, right? And on the other hand, in Latin American countries, you have these people that is saying, it's enough, this is enough. We don't want to continue in these conditions. We want to go back to normality, whatever that means. And they are fighting against those, as Dr. Echo was saying, those impositions to their liberties, right? They need to be, or they want to express themselves whatever they want. There was I will put an up aside in that sense. I think that the fragmentation occurs also within the society. It is not only from government to society. And that's the biggest risk in this kind of crisis. I was thinking in the case of Mexico, how people start thinking, well, we are on ourselves. We need to manage this by our own, because the official government, the government is not giving us any kind of hints. The official channels are not saying anything. The media is not helping us at all. So we are going to start doing something on social media, and they start making accounts just to shaming people. And they start announcing that person shouldn't be outside. They are violating the quarantine. And they start calling those COVID idiots. So they start replicating this kind of social media pages and social media accounts. And that fragmentation is making more difficult to really focus on the goal, which is we need to wait for a vaccine, and we need to see how we can flatten the curve. And that is not going to happen if you don't have, or if you have several channels, and also you are replicating the same government fragmentation, but within the society, within all the citizens of that country. At least in the case of Latin America, I believe that it's going to be a long road ahead.
I think in Africa, most of those restrictions are collapsing, because people who are on the very verge of existence, who are living on a day-to-day basis, they cannot afford the luxury of staying home indefinitely, number one. Number two, the educational system. The educational systems are so rudimentary. Some students have never seen a computer in their whole life. So the very idea of an online education is just out. You have a very small elite, maybe less than 10% of the population, less than 10%, who can afford to have online education. The other 90% have no computers, they have no internet connections at home, a lot of people have cell phones, but that's it. So you cannot have an educational system for countries, whole countries, when the thing is locked down. So the government said, okay, no high schools, no private, even private instruction. People don't pay attention to it. They say, okay, the minister, the government officials, they are rich, their families can afford computers and so on. We down here, we have no electricity. The villages have no electricity, let alone computers. So it's like that. That's what we call in communication the digital divide. It's pronounced. There's one group of people who have all the technology, they have electricity, they have running water in their houses, they can stay home 24 hours. And then there are the others, the majority who do not have these things. They have to go. So the people just started going to school, and the government, even even some of the soldiers themselves who are supposed to enforce this, they themselves their kids have to go to school too. So school people started going to school without, anybody paying attention to anything. So the restrictions are collapsing. That's my point. They're collapsing in many countries without the government having the power to do anything about it.
I'm also on the same page with Dr. Echo and Gabriel. In Pakistan, it was getting more and more difficult for the government. As I said earlier, like 65% of the populations they are daily wagers. So the government came up with a solution over there. They introduced the idea of smart lockdowns. So they started opening up the entire country. They said like in fact, like from yesterday, all of the universities and schools, they are back in business now. But government said like anywhere where cases start rising, we'll start implementing smart lockdowns in those specific areas, geographical locations, so that like other people, it's also like a reward and punishment kind of thing. Hey, you guys did not care well in your communities, so we are introducing smart lockdown here. But on the other side, other people are basically going out, they're doing their stuff, and so things are happening. Of course, I don't think like it's gonna last forever, because we still have to see what happens during the flu season in Pakistan as well. So, but at least at this point, the country has started opening up. September 15 was their main deadline that has passed, and they have started coming back to business. Of course, they are wearing masks, not everyone, but some of them are wearing masks and stuff.
Rauf, I have a question. I just saw a couple of days ago, there was a huge demonstration in Pakistan, an anti-Shia demonstration. It was a religious demonstration. I didn't see people wearing masks. So I wonder what is the reaction of the government if a whole community, I understand there were some radical parties, came out and they're having this huge demonstration, a little bit like we had, Black Lives Matter here in the United States, without any masks. What is the government reaction to that in Pakistan?
Dr. Echo, this is really interesting now. So Sindh government basically is opposed to the federal government in essence. So they are shifting the blames on each other. So like federal government is saying, hey, Sindh government is responsible for not taking care of these things. But at the same time, like monsoon rains, they brought so much flooding in that area, and people have actually displaced from those areas. So also like, so now the whole news focus, the shift is towards those floods, and like the federal government has started saying they're not caring about the masks, they are not even handling the floods. And so like it's a political game scoring right now. These are bigger challenges, Dr. Echo. So I think also like one more thing, what I want to add, at the same time, federal government intentionally has reduced the number of tests, so that like even though tests are very cheap as compared to Bangladesh. So Bangladesh, I totally forgot to mention on a side note, Bangladesh increased, the government jacked up the price of corona tests so that many people don't have tests. And that's how like they started like showing the world, hey, everything is okay, because majority of those factories, like the textile factories and stuff like Gap or whatever, Banana Republic, even Hugo Boss, they have they export their stuff there, and so like their textile factories had to run, and they tried to manipulate the data. It is very, I think there are so many gray areas, and at some points, including Pakistan, there are many darker areas. India, like they opened 12 routes for their train systems, even though they were advised not to do so. But they said like, like we have to continue the business. It's a tricky situation. But Dr. Echo, yeah, politically, Pakistan is going through another turmoil. Since we agreed, like Ken said, like we will not touch upon politics directly, but still I think there is so much difficult, Dr. Wilkinson, that we isolate corona from politics. It becomes very difficult. I don't know.
It is very difficult. I just didn't want this to become sort of a discussion of the political aspects, because we could have dedicated the whole thing to that. And we've got, these communication students who we're putting a lot of trust in their future to be making, decisions. So we're really happy they're here. I want to give just like a 30-second spot if any of the speakers would have a point that they really feel like they need to get out before we move toward a close.
Again, to the Nora asked earlier, how long are we going to stay in this kind of food? I think really the entire world is just waiting for the vaccine to come out. Again, in Mongolia's case, although it does not have a community spread and 0 dead, the country stays under quarantine. And basically our prime minister came out and said, we're not gonna open our border until the vaccine comes out. And again, even though they don't have community spread, put the schools back in like 3 or 4 days out of a week, and they operate as there is a spread. And going back to Dr. Eko's point about this neo-patrimonialism is really true. We need to understand at the backdrop of this global pandemic, each country is governed by politicians and decision makers, and these people add another complicated layer of governing and managing this whole crisis situation, and they insert their own agenda to their advantage. So that is also something we need to keep in mind, and that's just across the world.
Okay, well, thank you very much for that reminder. And I want to thank all of our speakers right now. Everybody, thank you for the time and thought that they put into this, and also for the audience for your questions and your interest and your participation. This really doesn't mean much, you know, for us as faculty and advanced graduate students if we're not sharing and interacting with the students that we are with every day in class, whether it's face-to-face or virtually. So thank you very much for showing up.